Well, good afternoon. I'm glad to be here with my colleagues today to discuss Obamacare 1 year later. The more the American people get to know about this $2.6 trillion health law, the less they like it. In the end, it might have been over 2,000 pages long, but the American people understand it pretty well. In short, the White House and its Capitol Hill allies passed an unprecedented expansion of Washington power with massive new subsidies for coverage and without addressing the number one concern of the American people, and that is skyrocketing health costs. All of this was paid for with billions of dollars in new taxes and by taking money away from an already struggling entitlement program. The American people understood that the historic expansion of federal power and the creation of new bureaucracy is never going to cease, but it would never increase efficiencies and make care more accessible. So 1 year later, what do we know about this law? $2,100 in higher premiums, 800,000 fewer jobs, $118 billion in new unfunded state mandates, $311 billion in higher health care costs, $529 billion in Medicare cuts to fund new entitlement spending, $813 billion in new taxes, and $2.6 trillion in new federal spending if we're lucky. It's probably going to be more than that. You'd be hard-pressed to find a more economically destructive piece of legislation. Just last week, the Congressional Budget Office concluded that, quote, growth in health care costs will almost certainly push up federal spending significantly relative to GDP under current law, unquote. So much for bending the cost curve the president promised. All of this damage comes before the Medicaid expansions and the new premium subsidies for the health law's insurance exchanges. In fact, the Secretary of Health and Human Services has the authority to waive these Medicaid mandates that states are begging to get out of. But the administration seems to be looking for any way to maintain this massive expansion that our states just simply cannot afford. Yet the American people's opposition to this law isn't solely based on bad policy, but also the lack of transparency on how it was enacted, what the true cost is, and how it's being implemented. They used every budget gimmick in the book to hide the true cost of this program so they can argue that it reduces the deficit when in fact it doesn't. They double-counted money to both, quote, shore up, unquote, Medicare, while simultaneously using it to fund this new health law. If that isn't fuzzy math, then I don't know what it is. And according to the Congressional Research Service, roughly 83% of the final rules implementing the health law circumvented public comment, which is typically required by federal law. Now, I guess this administration's pledge on transparency is another discarded slogan, discarded when it became an inconvenience. Just yesterday, Senator Enzi and I reminded the administration of its failure to brief Congress on the health law's implementation. This includes a failure to respond to 67% of Republican member requests. But Secretary Sebelius today refused to commit to answering those requests within 30 days, as I asked her to do. 1 year later, it's abundantly clear that this law is a budget buster that raises taxes, increases already skyrocketing health costs, puts bureaucrats between patients and their doctors, all while putting our already fragile entitlements on an even worse fiscal footing.
1 year into health reform, we know that it's full of empty promises, that it threatens jobs, that it will affect families, small businesses, and especially seniors. You know, we said during the debate that you can't take $500 billion out of Medicare. $500 billion, $529 billion to be more precise, out of Medicare and expect it to stay solvent. It was already in trouble. So how do you force CBO to score that so that it's okay? You say, we're going to form a commission, and each year the commission is going to bring a list of things to Congress that they have to do in order to keep it solvent. And if we don't vote to do those things, then they become automatic. So seniors can look forward to a lot more cuts than what they're already complaining about. Medicare Advantage will be nothing compared to that. The doc fix was supposed to be included in it. There's $280 billion worth of liability out there in order to pay doctors adequately to be willing to take Medicare patients. We said, if you can't see a doctor, you don't have insurance at all. But that's what's happening. They're refusing to take Medicare patients because they don't get paid adequately. That could have been fixed if there is that $500 billion of money that's extra. If it would have stayed in the Medicare program, it could have solved some things. And how about the mandates? That's what the states have been taking on. I think it's up to 26 states now that have taken that to court, and there's a mixed variety on that. But I can tell you that the American people are livid over being told what kind of insurance they have to get as a minimum, and that they have to buy it. And small business, of course, is saying, we can't do that, and those of them that are excluded because they have a small enough number of employees are not adding any employees because they're afraid of what the final rules are going to have. You know, the president said, if you like what you've got, you can keep it. Well, now that the rules are out, we can see that that's not possible. So over 1,000 different businesses have asked for a waiver on that, and the big ones have gotten it. What's that going to do to the small businesses? What are their chances of getting a waiver? And if the law is so good, why is a waiver needed anyway? Let's see, the president promised tort reform. He said that it's not in there. He admitted that at the last State of the Union, but he said it has to get in there. Do you think we're having any progress on getting tort reform? I don't think so. But he always says, if you have any ideas, give them to us. I've spent 2 years giving him ideas on health care. You know how many are in the bill? Only the ones that were in the original version of the Republican health care bill. We have ideas. There were 4 separate bills that would have done what the president said needed to be done, and they would have been paid for. Those were kind of thrown out for the promises that were made that aren't in the bill. We went to Blair House and spent a whole day there. That was so Republicans could share their ideas with the president. What did he do? As soon as an idea was brought up by a Republican, he rebutted it. When it was over, I said to him, you know, when I was mayor and I did a hearing session, what I did was listen. And I made notes on a pad. And at the end of the day, I said, these are some things that I really like, and these are some things that I'll consider some more. His speech had to have been written the night before. So last month, CBO said that the new law is going to cost full-time employees 800,000 jobs. That's the benefit of having a or a health care reform bill that it even includes little tax things like Form 1099s. That was extra reporting that businesses are going to have to do so that they could find $16 2/10 billion to help fund this reform. And that would only cost businesses about $30 billion to collect that extra information. There are a lot of net losses in this, and we need to do some tremendous things. First thing would be to repeal it so we can take care of this Medicare problem and do the doc fix.
Senator Hatch and Senator Enzi have laid it out very well, and I'll try to focus my remarks on just 2 aspects of this. First of all, the healthcare policy aspect of what we now see 1 year later, and the fiscal aspect of what we now see 1 year later. On the policy side, you'll all recall during the debate, the issue was rising premiums and how do we deal with access to health care. Now 1 year later, we see the result. It's exactly what we argued at the time. The headlines are premiums are going up and benefits are going down. Employees in small businesses are seeing their wages impacted and their employment opportunities impacted. And unemployment is growing as a result of the pressures, the regulatory and financial pressures that the bill created. At the time when we debated the bill, we talked about the fact that the only way on a fiscal level that a claim could conceivably be made that the bill was deficit neutral or actually helped to reduce the deficit was to cut Medicare by $500 billion, to increase taxes by $500 billion or more, and then engage in the various budget gimmicks that simply just shifted the cost and revenue portions of the bill in such a way to make it balance out. America is now seeing the reality on a fiscal level, that this bill is, in fact, a huge expansion of the federal government. As Senator Hatch said, a $2.6 trillion increase in federal spending over the next 10 years. That is just adding to our problems now of trying to deal with our national debt. Our national debt, already over $14 trillion, approaching 100% of our GDP, is being fueled in significant part by the massive explosion of healthcare spending that is put into effect by this law. And again, the only offsets that were of significance were the phenomenal hit on Medicare, which, as Senator Hatch mentioned, was double counted in terms of the numbers, and the phenomenal hit on taxes that Americans are now paying. And what we are now seeing, which was really hidden in the bill, which is the phenomenal hit on employment in this country as small businesses across the country are forced to retrench in the face of the mounting pressures of increased benefit costs for their employees. The fact is that we could have and should have done much better. There were solutions that were proposed at the time. Those solutions need to be considered now that can truly help to reduce the cost of health care and to increase the access of health care without putting the federal government in such a massive control position in the healthcare economy and without growing the federal government in such a massive way.
Well, thank you, Mike, and thank you all for coming. I'd like to return to the not-so-thrilling days of yesterday. This is a happy birthday. I would just as soon not celebrate. Too many candles burning on the cake. But it started off in the Help Committee, and we worked into the wee hours of the night, and I'm privileged to be a member of the Health Committee. That bill is now sitting somewhere on a shelf collecting dust. We never even got a CBO score on it, let alone read it. Then we went to the Finance Committee. Everybody here, for the most part, on the Finance Committee spent into the wee hours of the morning. I had 11 amendments on rationing, especially with the 4 rationing commissions and groups that are part of this bill. One just mentioned in regards by Senator Hatch that dictate how much we reimburse to the medical health care delivery system. But at any rate, it was in the wee hours in the morning, and I had 11 amendments on rationing. And I saw where we were headed after the 9th, because it just went down on a party line vote. So I asked that the 3 be considered en bloc. That means all together. En bloc is a Senate word. And of the 3, I put in Schumer's amendment, just to be ornery about it. And so obviously it was defeated because I offered it, and then informed the chairman and Chuck Schumer that his amendment had been defeated. They had to go back over and take his out and then pass it, which shows you the tenor of everything and what happened. So then it went from the Help Committee, the Finance Committee, to the Reid Committee. And there he met Charlie Rich, and he and Charlie Rich sang behind closed doors. And the product came out far different from the Help Committee or the Finance Committee and now the Reid Committee. And we're living with the results. I just don't think that's the way to handle legislation. The process broke down. Now is the time to restore the process and the committee system. We had just today, I thought, what was a pretty fair hearing with Kathleen Sebelius, the Secretary of Health and Human Services. And this time, even though we had 2 votes, we were allowed to at least have about an hour or 2 in terms of questions. And my questions were basically on a group of healthcare providers that she knows and I know from Kansas. And we had everybody hooked up with any kind of providership in healthcare. We had ambulance drivers, my word, we had doctors, nurses, hospital administrators, hospice people, the pharmacist, so on and so forth, and especially home health care. And they were so worried that I said, okay, list the regulations that you are really worried about. And they told me, okay, we know about the current regulations, but about every second foggy night another one jumps out and bites us, and we're worried about the future regulations. And so they listed 34 egregious regulations and divided them up into categories. And I sent that as a letter to the President and to the Secretary. Now, that was about March what? March 6th. Now, that's too early to get a response back, so we hand-delivered to the Secretary, to Kathleen, our concern about all the regulations. You are not going to be able to preserve the rural health care delivery system or any health care delivery system with this massive wave of regulations that are about to drown the healthcare system in regs that just don't make any sense. That's why the President issued an executive order on January 18 to say, okay, we're going to take a look at regulations, and we're going to have a cost-benefit yardstick up there, and we're going to make every agency take a look at it. The problem is there's so many loopholes in it. It is a executive order without any teeth. And so I have a bill to codify that, take the loopholes out, and really force the different agencies to take a look at all the regulations, chief among them healthcare. And I will say this for Kathleen Sabich. She says, we're going to go take a look at healthcare despite these loopholes, and we will get back to you. Now, when, I don't know. I'm like, unlike the rest of these gentlemen, when you write H2S and you list a whole series of things that you want to get across to them because of the healthcare providers in your state or your region, it takes quite a long time. Let me just say that this has been such a most unfortunate path that we've taken. I said at the first, right at the first, we ought to have a flashing light up there at the back of the committee room, do no harm. But yet, we didn't do that. What we did is we mounted up and we rode heck for leather into a box canyon, and that's where we are now. The best thing to do is turn around and get out of that place and see if we can't enact favorable legislation that's already been gone over by Mike and some others, and all of us are co-sponsors on a Republican answer. So I'm extremely worried and upset about this anniversary of a bill that really did not do what it said it was going to do and is going to cause a lot of problems. Thank you.
I'm going to focus on the private sector. We've heard a lot about the government and the effects on the government. I'm going to focus a little bit on the private sector and what it's doing to real people out there. I traveled my state over the last many months, talked to a lot of different business owners, and especially small business owners. The rate of increase in their premiums is just astounding. I heard as high as 35%, one company, and that company even said they raised their deductible to $1,500 just to only get a 39% increase. This morning, Steve Wynn, many of you have maybe heard of him with the Wynn Resorts. He said I was full permission to use his name and these statistics. They studied their health care increases for the last 5 years, from 2005 to 2010. They have had an average increase of 8%. They've done a lot to hold their health care costs down. This year, their health care premiums went up by 12%. That means there's a 50% increase in their rate of increase. What does that mean to a real person? And by the way, Steve Wynn is known in Nevada as probably the most employee-friendly employer. The unions will tell you that. The unions love Steve Wynn as an employer. Well, for the average Wynn employee, even though he absorbed most of the cost, it's still going to cost each one of them an average of $800 to $900. In a struggling economy, that's a lot of money. And he thinks that in studying this bill, that it is going to get worse in the future. So this is affecting real people. Now, the small businesses that I've talked to, you hear this word called uncertainty. This is one of the places they are afraid to invest in their businesses because the uncertainty of the health care bill, what it's going to do to them in the future, whether they crack that magical 50 employee mark, or whether they're going to be able to afford their health insurance, or whether they're going to be able to keep the policy. Remember what President Obama said, if you like your health care policy, you'll be able to keep it. Well, that's if you don't change your policy in any significant form at all. I asked employers all across the state of Nevada, how often do you change your policy? Every single one of them, without exception, said every year. Every year when they renew, they make changes to their policy. Well, if you make any of the changes that most employers make, you will no longer be grandfathered in, and because over 2/3 of the policies in Nevada do not qualify under this bill, under federal minimum standards, they will not be able to keep their plans. So it is an absolute false statement that was made last year by the administration and the president. These are just a couple of the reasons, along with what other senators have said out here, why we believe so strongly this bill needs to be repealed, and then we need to enact legislation that goes after the #1 problem in healthcare in the United States, and that is the cost. We have all kinds of ideas, medical liability reform, and many other ideas out there that'll lower the cost of healthcare. This bill did not attack the #1 problem, and that's why we want to see this bill repealed and replaced with true healthcare reform that'll lower the cost of healthcare in the United States.
As a physician, the number one complaint I get in my practice is my health insurance premiums are rising. That was the number one complaint before Obamacare, and it's the number one complaint after Obamacare. Now they just say my premiums are rising even faster. One good thing came out of Obamacare, though. We're having a full-throated debate in our country about whether or not we live in a democracy or a constitutionally limited republic. This is a very important debate, and we haven't had it in 70 years. There is a court case that is debating, do we live in an unrestrained democracy, or is Congress or government limited by the Constitution? When Nancy Pelosi was asked this, she said, well, the Constitution, she said, what's the Commerce Clause? This is an important question. This case will go to the Supreme Court. If the Supreme Court rules that the Commerce Clause does have limits and that we can't do anything we want, it will be the biggest reform to big government we've seen in 70 years. I'm predicting we have a very good chance at the Supreme Court, and I hope we will see a reversal and some restraint on big government when the Supreme Court strikes down this bill. Thank you.
Thanks, Ray. Appreciate it. Any questions for Rand and me? Yes,
Since
ma'am.
you're the only one here, you're going to have to.
Well, Rand's here.
I think most Americans would agree that the healthcare system wasn't working too well before the law was passed. Tort reform was mentioned, but can you give us a clear idea of what Republicans would push forward if the court strikes down the law or if you're successful?
Well, let me give you an illustration. You all heard of the S-chip bill? Okay, I wrote that bill. Everybody forgets the letter S. When it was written, S stands for state. What we did is we had 50 state laboratories on S-chip, and we block granted the monies to the 50 states. Now, almost every state worked very well with their own demographics and solving their own problems. And it worked amazingly well for as small a bill as it was. It took care of 6 million kids. What Republicans would do is we believe that it's important to practice the principles of federalism, and that is we would have 50 state laboratories. We would have the government give money to the states, have these 50 state laboratories where they could do health care in accordance with their own demographics, with their own people, and you'd be able to pick and choose from the various states what works and what doesn't work. We would not limit it to one single policy decided by Washington, D.C. We'd have it decided by the people in the respective states. We would allow cross-state line purchases of health insurance. We'd allow small businesses to get together and pool their resources so that they could have appropriate approaches towards health insurance. We would certainly try to do something about medical liability reform. It's very difficult because the Democrats will not take on their personal injury attorney supporters that are as high as the unions on hard money, nowhere near the unions on soft money, to get out to vote for Democrats. And we would do a whole raft of these things that have worked beautifully in a representative republic that allow the states the flexibility to be able to do what they need to do. We certainly wouldn't pile on like this administration has, taking $529 billion out of Medicare that is $38 trillion in unfunded liability, and then using it to fund another unfunded entitlement. I mean, that's really what they've done. And then they double count it. And I'm not quoting a Republican here, I'm quoting the CBO and the administration's own actuary. That it's double funded. You could go on and on. There are a lot of other things we do, but we know one thing: if we could reach a point where the states had the power in accordance with their own demographics, their own state needs, we'd find the money's going farther. They'd work better. In the end, we would have a system where you could cross-breed and look across the aisle and look across the states and say, well, hey, we didn't try this. Maybe this works. And we would be able to, I think, have something that would really work and work well. That's the difference between the two parties, really. The Democratic Party thinks everything has to be done here in Washington. And we think that basically the states do a better job with Washington's help. And since Washington takes in all the tax money, the states, I could go on and on, but you have a question.
Along those lines,
If you feel like popping in, you just feel free.
Along those lines, I think it's a good segue that
I'm sorry.
There's bipartisan legislation that's out there that the White House supports that basically gives states more flexibility at a sooner time.
What do you base that on bringing it down from 2017 to 2014?
Yes, sir. So that would give
As
states
long as it's the same health care program, you can't have anything less than what they're demanding.
Right. So you have to.
And we all know that most young people don't have health care problems. And so if you're going to have them have health care, it seems to me you'd want them to have a high deductible policy that costs a lot less. And it'd probably never be used, but at least it would be protective of them.
So you're not going to support that legislation, or you?
No, we're gonna do something about that. Their whole maintenance of effort approach is really crazy. And you know, when I have to say this doc fix thing should have been fixed in the bill. We would have fixed it. I wanted to fix it. It was $270 billion then. Today it's $370. $370 billion bucks over 10 years, and it's not fixed. And unless we fix that, there are going to be more and more doctors refuse to take Medicare patients, and a lot of refusing it now. And what's even worse, a lot of doctors are getting so discouraged, they don't want to stay in their profession anymore, and they're going to quit. And we're already really deficient in primary care. We really don't have the primary care physicians that we really need in this country. And if they got to be paid by Medicare in these low rates, and who's going to pay for that? The secretary today said, well, in 3 years, we're going to help take care of all these Medicaid people that have been brought into the system. I said to her, with what money? How are you going to pay for it? And she didn't have any answer for that. She muddled around there because they don't have any money to pay for it unless we just continue to borrow and borrow. Well, I could go on and on. There are a lot of other things Republicans would do, but I think you'd find it would work a lot better than what this dog is going to do.
Last question.
Well, there are two, because I said back there first, in the back first. If you don't mind, I'll come to you, okay?
Senator Hatch,
Feel
the
free.
main leverage Republicans have to repeal health care is either on the CR or in one of the spending bills to potentially have a showdown with the president. Do you think it's worth either risking a government shutdown in order to try and repeal health care, or actually having a shutdown?
Well, I don't think that's a good question, but I don't think anybody's talking about a government shutdown over health care. Now, we are talking about, facing the music on health care, and we need to do that. Now, let's be honest about it. I raised the unconstitutionality of both the job-killing employer mandate and the unconstitutional employee mandate. Now, that's in front of the courts. The administration wants to slow walk it. They shouldn't, because we're getting into all kinds of problems as we go along here, even though most of this bill doesn't trigger until 2014, mainly so they could say it was around $1 trillion rather than the $2.6 trillion that we all know it is. But I've got to tell you, if you look at it, there's just no question that there's no way to pay for this. And the states are going to get hammered again. I mean, tell me, how's California going to pay for it? It's $25 billion in debt. Some say as high as $150 billion. Illinois is worse than California, worse off in California. New York, New Jersey in very difficult straits. And what they want to do is have all the other states that have lived within their means now pay for their profligacy. We can't do that. So, that's where we are. Yes, sir.
I'd like to phrase the question a little differently.
Okay.
Several House Republicans have made it clear they will not support the CR, any CR, as long as it contains money to implement the law. Are you ready to say same here, or if not, why not, since you obviously don't like
Well,
the
I
law?
personally don't believe that we're doing enough about cutting back on spending. So I have trouble with the small CRs. I think we've got to do a big CR, and hopefully we'll be able to get that done. And I don't know anybody on our side who wants to shut the government down. I do think there's some on their side who want to do that so they can hopefully blame us.
So nobody's talking about making defunding a precondition of any support for CR? That's not a good idea? Or?
I can't say that. I can't. All I can say is that we think that there should be more fiscal restraint in the CR. Okay.
Thanks very much, everyone.
All right. Thanks so much.
Senator, do you think in the